Hello viewers, sorry for the delay. We had some connectivity issues with the doctor. So now everything is set. So we are back again. So before I start, on behalf of Ekadaksha Learning Center, we welcome you all and wish you all a happy and prosperous new year. I am Bharati and today I'll be hosting the session. Okay, so we all would have by now come to know by seeing us in social media that today's topic is going to be all about nutrition, and nutrition. And it's a very apt and needed topic in this pandemic situation. We would also like to inform that after a long break, we have opened our office and of course with all the necessary precautions of masks, sanitizers and social distance. So coming to the series, this will be a series of 4 episodes focusing mainly on children and young adults. And we are very much honored to have Dr. Varsha today to give us lots of information on nutrition. Dr. Varsha is a consultant clinical nutritionist, certified nutrition injury specialist. She is the founder chair of Indian Institute of Nutritional Sciences. Dr. Varsha is a very good friend and well-wisher of Ekadaksha. She has been working with our children and guiding us and the parents with regards to the nutrition and well-being. Welcome, Doctor. We are very happy and privileged to have you today here on our FB Live program. We would also like to inform our viewers. Yes, Doctor. So we like to inform our viewers that today's topic is going to be about importance of nutrition. So Dr. Varsha, actually we all know that nutrition plays a very vital role in our lives, in our children's lives especially. And as parents, we are most of the time confused or always having doubts whether we are giving the right food or the right nutritions, or whether what we are giving is correct, or how much to give, how much not to give, what to give, what not to give. Actually, this list of doubts keeps going on. It's never ending, right? Be it from the very infant age till the young adult age, we parents are always in one big confusion. So today we would like to understand what are the basic standards, and also when we need to worry, when we need to seek assistance. So over to you, doctor.
Very happy new year to everybody at Ekadaksha. It's my pleasure that I am able to interact with you. We did do a session in person earlier, but I think in this COVID times, we are going to be able to do this online. So let's get on with the session. The next slide, please. See, basically, what we're trying to understand is that the child, why there should be importance of nutrition. My objective is to educate you, the parent, on what are the basic standards so that they can understand the deviations and seek assistance to correct and rectify the faults. I want you to understand one thing. This is a standard that we talk of for every child, and they are supposed to achieve these milestones. So if your child is not reached that milestone, you need to be aware and you need to seek assistance to let that happen. Now, the important thing in that is that you need to remember this bottom line. Children are not miniature adults. So all the time, the parents tend to, compare themselves with the child and say, "Oh, I used to do this," or "This is what." If the family has only one child and the parents are two adults in that family, the chances are that what the father likes or dislikes the child knows, or what the mother likes or dislikes the child knows, but what the child likes, neither the father or mother knows it. This is usually the sad state of affairs. So please understand that do not take your children for granted. They are not miniature adults. And in this slide, I am trying to make you understand, see how different at each age group of a child, the nutrition aspect changes. And the interesting thing is that while we say child as one category, you can see here that newborn neonate changes from 0 to 7 days to 0 to 1 month. And it still encompasses it as a lactating infant 0 to 6 months, where they are only voracious drinker. But the sad thing is you still find that with the grandparent, the child will be having biscuit dipped into it, made soggy and pushed into the mouth, which is a very wrong thing to do. They are only voracious drinkers. Milk is the only thing they drink until 3 months of age. I will be giving you what they should be drinking at other points of time, but I want you to understand here that the age limit 0 to 6 months is voracious drinker. Then we say it's a weanling infant. That is, they transit from a drinker to an eater between 6 and 12 months, such that by the time the child is 1 year old, the child will eat almost half the quantity of what the mother eats. Just imagine what is the standard of the mother. If mother eats 4 idlis, the child should eat 2 idlis by the time the child is 1 year old. So mother is the standard, and you just don't take it for granted that you will have some fixed way of feeding this child. The next level is toddler. Now, why have I written the word autonomy next to it? Is because that is the age at which the child wants to do things on their own. Everything is put into the mouth. They want to explore on what it is. So that is why they're called exploratory eaters. And this age range is from 1 to 2 years. And the next stage is preschoolers. These are the ones who will take an initiative. But what they would do is they will binge or they will refuse. They will either love one particular food for a period of time, and then suddenly one fine day they will not touch it at all, they'll refuse it. Now, this age range is in the 3 to 5 years, and it's also the range which is known as finicky eater. Now, why we need to give you this information on nutrition is because generally, when we say preschoolers, is the time when the school child starts going to the daycare centers. And then the next is child industry. In this industry, what is that? Tween or school age child, 6 to 9 years of age, is an imitator eater. That is, they will like to look at what others are doing and try to follow and eat in the same fashion. And then there is an adolescent where they seek identity. This is divided into 3 age groups: 10 to 13 years, 10 to 12 years, 13 to 15 years, 16 to 18 years. And each of these 3 different categories requires a different requirement on nutrition. So they are called the challenge eaters. Next slide. So having looked at how age and nutrition is related to each other, you now need to look at it in terms of how, what you should give importance. You need to understand eating habits established now impact food habits and health later in life. Children need adequate intake in order to achieve full growth and developmental potential. Undernutrition impairs children's cognitive development as well as their ability to explore their environments. If they are not able to move around and look at the world, they are not going to learn anything at all. You want the child to be naughty. You want the child to be up to mischief because that is their way to explore the environment. Long-term effects of undernutrition like failure to thrive or cognitive impairment may be prevented or reduced with adequate nutrition and environmental support. Next slide. So when you look at it in terms of the balance that we need to have, every child to have, is that they must have positive energy balance to support growth. That is, when I say positive balance, energy balance, how much of energy is coming in because of feeding, when do they sleep, how much they sleep, and then how much energy is put out playing and inactivity. This balance has to be perfectly made. Now here I want to emphasize that when I talk about the word sleep, you have to relate it to the circadian rhythm, the rhythm of the sun. And that is why it is very, very important that the child sleeps as per the sunrise and sunset. Many children are awake late into the night and sleep during the day this will not allow the energy balance to happen in children. And then the next thing important is assessing readiness to feed, the feeding skills development. Now look at this, 4 to 6 months, the experience of new tastes is started. That is why we do include some amount of cereal in a mashed form at 6 months of age. 6 to 7 sits with minimal support, so you can add fruits and vegetables. 8 to 9 months, they improve pincer grabs, so you add protein foods and finger foods at that age. 10 to 12 months, pulls to stand, reaches for food, add soft table food, allowed to self feed. 12 to 18 months, increase independence, stop bottle, practice eating from spoon. 18 to 20 months to 2 years, growth slows, interest in eating is less. You encourage self feeding with utensils, and by 2 to 3 years, the intake varies, but it exerts control. So, this is the guideline that you need to follow. And if your child is missing any of these milestones, you know for sure that you need to look out for some support and see that the child is given balanced nutrition. Now, there are major problems all over the world that children face: protein energy malnutrition, obesity, micronutrient deficiency of iron, iodine, folate, vitamin A, zinc, etc. Nutrition related chronic diseases. Nowadays, we know that, even children get diabetes, they get all sorts of long-term diseases that we see in adults are also coming into children. And then there are common nutritional problems and disorders that include dental caries, constipation, diarrhea, overweight, obesity, cardiovascular disease in children, iron deficiency, anemia, lead poisoning, and insulin resistance. So I can take more sessions to discuss each one of these. But what I'm trying to highlight to you here is that there are gamut of problems that nutrition challenges in children come into play. So you need to recognize the changing nutritional needs of developing children from infancy and adolescence. That is your first challenge. Then you need to understand that nutritional recommendation for children vary by age, stage of development, and gender. Remember that growth may plateau while eating patterns are changing. Supplements can help here. And that is why you have to be very actively following as far as your child's nutrition is concerned. Further challenges in nutrition are hello. Hello. Am I heard?
Yes, yes, doctor. We can hear you, doctor.
Okay. Oh, yeah. Okay. Okay. So when you look at it in terms of the feeding and growth concerns, which are common in all cultures, it's not just that, in Indian children only we have problems and the rest of the world there are no problems. But our cultural problems are what we need to look at and provide different interpretations and the range of family responses that would be coming into effect. So the feeding concerns are related to normal growth and development patterns and are best addressed by health professionals. This is where I repeatedly keep telling people that you are required to come for a follow-up. See, I have taken assessment of children. I have reached out to the parents at several points of time. But unless you do a follow-up, you're not going to be in a position to take care of your child at all. So this is very vital. Please remember that when it comes to the health professionals' assistance, this is very vital because your child's age range, as you have seen, goes up to 18 years as such. Okay, next slide. Now, what are the parents' concern? Most of the time, parents are only talking about having difficulties in feeding their children up to the age of 5 years. world over, 1/3 of children are described as having feeding difficulties at some point. And parents rank feeding issues as number two behavioral problem. Crying is the first one, frequently left unaddressed by their pediatrician. So the pediatrician is not geared up in helping you to solve the problem when it comes to the feeding. Okay, they will just say that, yeah, you start feeding the child, but they don't know what exactly must be done. Now, this is what I want to highlight to you very much: the feeding conflict. Can you see there the parents' pressure to eat? That is, I've never seen a mother who has ever told me my child eats well at all. Invariably, they have a different standard. That's the reason why I'm taking this session, to make you understand what should be the standard. But the more you will pressurize your child, the more you will have the feeding resistance in your child. You need to understand this is a very vicious cycle, and this is where you need to see how you will intervene, that your relationship with your child should not be jeopardized, because the moment you do that, the growth pattern of the child is adversely affected. So if you're encountering feeding difficulty, you must seek assistance. Okay, next one. Now, this is where we talk of division of responsibility in eating. When I said that you don't want to create conflict, what is the parent responsible for? What the child eats, when the child eats, where the child eats. This is the parent's responsibility. But concurrently, look at what I have indicated at the bottom. Child is responsible for whether they should eat and how much they should eat. So you do need to give some amount of autonomy to your child, and let the child be responsible on whether they want to eat or how much they want to eat. You don't force them. This is where you will be able to understand that division of responsibility in eating gives a very healthy atmosphere without any resistance. Next one. When to worry. Having said this, when should you worry as a parent? Very many times I ask the parent, how old are you? And each one, the young mother might say even she's 18 or 20 or 21, and the father says he's 20 or 22 or 24. No, you are as old as your child. If your child is 6 months old, you are a 6-month-old mother and a 6-month-old father. Please do understand that. But and that is the reason why very many times as a mother you have very little experience itself in handling your child. But there is a 21 or a 22 or a 25-year-old who has seen world and who should be able to interpret certain things. So here I want to list out to you as a parent when you should worry. When the child is underweight or not following a growth curve. The very first slide I showed how the child is growing up the curve, right? So if that growth curve is not being followed, you need to worry as a parent. So now you understand, it is not one time looking at a health professional, it's not one time that you come to a dietitian, but you need to keep following up yourself to see if your child is following the growth curve, there is any faltering in height and weight. When I look at height growth, I'm looking at both height as well as the weight. Height is a long-term issue. If the child is deprived for a long time, you will find that they are stunted. That is, they are not growing in height. But when it comes to the weight, it is acute. Your child might be looking very fine in the morning, might have good weight, couple of episodes of vomiting or loose motions, and by evening, the child would have been like a flower that is withered. So, that is known as an acute condition. So we need to follow both the height and weight as far as the child is concerned. And if the child is not maintaining that, then you should be worrying. Concerns about micronutrient deficiency like iron deficiency, calcium, which is required for bones, vitamin D, which is also required not only for bones, but for their hormones that are essential for their growth. So if they're having any of the micronutrient deficiency, then you need to worry about that. Pattern of pickiness suggests an oral motor problem or food sensitivity. When extreme or prolonged, these can result into major issues as far as children is concerned. Now, there are also allergy concerns. Everybody has this word which is bantered around as allergy. There is something allergy versus intolerance. And it is only a professional who will be able to understand if it is an allergy or an intolerance. If the child refuses entire nutrient groups, consider a food sensitivity or a food allergy. For example, dairy or gluten. Gluten comes to you mainly from wheat, and we are introducing wheat without understanding in young children through use of biscuits and bakery items. So you need to be concerned about it, and it is usually accompanied by physical manifestation of either constipation or diarrhea or rash. There could be an eczema or hives. So the allergy concerns are something that you should be aware about. Now, coming to picking eating. Now, what is picky eating? Being a picky as a child, this is the word is neophobia, is normal and adaptive with wide temperamental variation. Either they eat everything or only likes three foods. Okay, this is how the definition goes. From an evolutionary perspective, for simple survival, children should be skeptical about eating any new food. Okay, it's a normal thing. They must question what you're trying to feed them. You just can't force them into saying that I like it, your grandfather liked it, your grandmother liked it. No, the child has to learn by himself or herself. It is their evolutionary perspective, right? On average, a food is offered 10 times before a child will accept it. Please remember that. So don't just give it one time and the child doesn't take it and say, oh, the child doesn't like it, and stop giving it to the child. You'll have to do it 10 times before a child will accept it. Children have a more acute sense of taste than adults and should not always be expected to eat what their parents or caregivers are eating. Please remember this. This is where I said right in the beginning, do not consider your child to be a miniature adult and force issues as far as children are concerned. Now, next one. You need to differentiate between a picky and a problem feeder. Picky is the one who eats fewer than 30 foods, eats at least one food from almost all textures, eat the same food every day, that is called food jack, tolerates new foods on their plate. They do tolerate, but they are adventurous to taste new foods, willing to eat new foods after repeated exposure 15 to 25 times. When do you convert the picky eater to a problem feeder? That is when they eat fewer than 20 different foods, restricted range or variety of foods and textures, foods lost to food jags and are not reacquired, cries and falls apart when presented with new foods, adds new foods in more than 25 times. That is, you need to keep on repeating them, then you know there is a problem. So you need to differentiate between a picky and a problem feeder. Next one. Okay, there is another word called selective eating. Extreme picky eating can cause growth problems, nutritional deficiencies, severe dental decay, dehydration, and constipation. So what you need to do when it comes to understanding selective eating is you need to keep a food diary. Is your child's diet varied enough? That needs to be analyzed. Try to understand what, where, and how your child prefers to eat. So it is very important that for us to categorize the child as either picky or problem or fussy, we need to do a lot of homework. We do need to maintain a diary. You think that, oh no, I remember. Well, you don't, because every day you're giving different challenge to the child. But I would caution you and warn you, don't label your child as picky, problem, or fussy eater in front of them, because the child reflects every action of what you convey. If you will say my child is picky, then it will prove to you that I'm a picky child. If you will say that your child is a problematic child, your child works hard to prove you right by being problematic. If you say your child is a fussy eater, then the child believes that that is what you need to do. So you need to understand that please do not label your child in right in front of them. Don't call them any names. Don't try to communicate to them and tell them that this is what you expect them to be doing. They are very obediently yours. So please Be careful about what you ask them. I also see a lot of parents who will, ask the child, what will you eat? You will eat for breakfast, idli or dosa. Remember, when you do something like that, the child will just turn around and, like an echo, speak the last word. The child will turn around and only tell you dosa, and you have taken a decision that your child has been so brilliant and has taken a call and has told you what they like. So please avoid doing that sort of a thing. Do not leave it to your child. Remember, I have already said what is your responsibility as a parent. What you're going to present to them is your responsibility. What you're cooking at home is your responsibility. Your cuisine is your responsibility. If you're a North Indian, you will have a North Indian cuisine. If you're a South Indian, you'll have a South Indian cuisine. So that is your decision. But how much the child must eat is a decision the child takes. So please understand that. I have given you an introduction on how it is important to consider nutrition at different age levels, and we will look at the next session where we will try to move forward on looking at the second part of the nutrition series. Thank you very much for your patient hearing. What you basically need to do is, this will be available to you on the Facebook. You could go through it in case you felt that you wanted some clarification. You are permitted to convey all your questions to Ekadaksha, and we will try and cover it in the next session before we begin the second session. Thank you very much.
Thank you so much, Doctor. Wonderful information, lots of eye-opening information. As you had mentioned, I really like that one slide very much where you said parents are responsible for what, when, and where, and child is responsible for whether and how much. But actually, to be frank, it's just the opposite. So we have to change that way. Yeah, really. And also, beautifully said that we should not compare or take the child for granted. Somewhere, knowingly or unknowingly, that happens right from the very young, small age itself. We do take, and a lot of comparisons are done. And of course, it really hinders the growth of the child, as you had mentioned in your presentation. And of course, follow-ups are very, very, very important. We know personally how much you have been taking that initiative with the parents to please keep coming, keep following it up. It will really help the child's development, growth, and a lot of factors, because as you had mentioned, the deficiencies, the calcium deficiency, vitamin D, the iron deficiency, it's something become very common now with the children, and it's something which we really need to take it very seriously, follow it up, have regular consultations, and do the needful, because of course we as parents are not very much aware as to how much to be given and all those things. So of course we need to get a good consultation. And beautifully explained, the doctor, and you have already given all the informations. So but still, I would like to inform all the parents and the viewers that hope you all would have got a very good information, important informations today from Dr. Varsha. If you have any further queries, you can post it here at our Facebook page, and we will surely get back to you with the replies from Dr. Varsha. So with this, we end today's session, and also we would like to inform that our next session on nutrition is on 29 January, which is next Friday at same time, 3 p.m. Next week, we'll start on time. Today, we had a little of connectivity issues, but next week, hopefully, it will not happen. And the topic will be responsive parenting. So see you all next week. Waiting to have another lovely session with Dr. Varsha. Thank you all. Stay safe and stay healthy. Bye-bye. Thank you, doctor. Thank you so much.
Bye.
Bye.
Bye-bye.